The Honourable Member from Calder, followed by Cypress Medical House.
Thank you, Mr. Speaker. Mr. Speaker, today the NDP released documents to show that PC neglect of the Royal Alexandra Acute Care Tower means that now a completely new structure is required in order to reduce infection rates. Cross-contamination risks are high because too many patients are in each room. The ventilation system cannot meet the bare minimum infection control standards. To the Minister of Health, why has your government ignored these serious hazards that threaten the health of patients for so long, and what are you going to do about it?
Thank you, Mr. Speaker. I would like to point out that just recently, in 2010, Government of Alberta invested over $170 million to build the new Lowell's Hole Hospital for Women, which is really one of the finest facilities in the country. And recently, they had 94,000 ambulatory patients come in, and what's quite wonderful, 6,500 births last year. To the honourable member's question, the Royal Alexandra Hospital is old, the tower is old, and it does need some work. But let's give credit to the people that work there. Their infection rates are better than anywhere else in this country. Alberta is one of the best in this country, and they're right with it.
First supplemental.
Mr. Speaker, given that the workers have to compensate for poor planning over a long period of time, they do a great job because this government did a very poor job in building the hospital and maintaining the hospital as well. To the Minister of Health again, planning implies forward thinking. How can you possibly plan for the future when you've neglected everything up till this well past the expiry date of this hospital?
Mr. Speaker, the Royal Alexandra Tower is a very, very precious part of the Royal Alexandra Hospital, which is a key to health care in the centre of the city of Edmonton. This government is putting together a plan to come out sometime middle of next year to look at what we need to do with the Royal Alexandra Hospital. We're committed to fixing it, and we will do all we can. But you know, Mr. Speaker, this hospital means a great deal to the people in the inner city. We have to maintain it, and we are maintaining it. There is incredible care given by the men and women who deliver it at that hospital.
Final supplemental.
Well, Mr. Speaker, given that these documents we released today also review, this government is considering building a Royal Alec Tower through a P3 model. Auditor Generals in both Ontario and Quebec have panned the ideas of P3s for hospitals, and this summer your government had to abandon P3 models for schools that did not get built. To the Minister of Health, would you commit today that your government will reject the P3 model for the Alex Tower, and if not, will you explain why you're going to put both public money and public health at risk when our healthcare system is already in crisis?
The Honourable Minister of Infrastructure.
Mr. Speaker, we have one of the most aggressive capital builds in North America taking place here in Alberta. We will look for the most cost-effective, solutions-oriented ways to build our capital infrastructure, whether that be schools, Mr. Speaker, seniors' homes, Mr. Speakers, and hospitals, Mr. Speaker, because what Albertans want is a focus on the services they need, and that's what we'll deliver.